you for participating in the Lovelace Medical Group Bariatric Surgery Seminar, and congratulations on taking the first step towards a healthier you. The goal of this seminar is to help you understand the dangers of obesity and its effects on an individual's life. We will review the surgical options available and the associated risks and benefits. Ultimately, we want to enable you to make informed decisions as you advance on your journey to health and wellness. What is obesity? Severe obesity and morbid obesity are diagnosed by determining one's body mass index, or BMI. BMI is the ratio of an individual's height to weight. Normal BMI ranges between 20 and 25. An individual is considered morbidly obese if their BMI is 40 or more. Obesity is related to multiple medical conditions including diabetes, high blood pressure, sleep apnea, heartburn, fatty liver disease, heart disease, high cholesterol, as well as various types of cancer including breast, ovarian, endometrial, liver, and colon cancers. Obesity can often limit our ability to enjoy activities like riding amusement park rides, playing with children, attending social gatherings, and even traveling. Obesity affects every organ system in our body, and so can weight loss surgery. Surgery can significantly improve conditions such as high cholesterol, sleep apnea, diabetes, high blood pressure, and heart disease. Research shows that the majority of patients who undergo weight loss surgery experience an improved quality of life and also have a reduced long-term risk of death. Surgical procedures not only reduce stomach size, but also address other factors contributing to obesity, such as genetic, hormonal, and brain set point components. Surgery helps reset these hormonal and brain set points, which cannot be achieved through diet and exercise alone. Who is eligible for surgery? 3 important questions to consider are: what is my BMI? What are my medical conditions? Am I fit for surgery? Your responses to these questions, along with a conversation with the Lovelace Medical Group Bariatric team, can assist in determining if you are a suitable candidate for weight loss surgery. It is important to understand that there are different types of bariatric surgeries performed at Lovelace Westside Hospital. We'll work with you to choose which one of these surgeries is right for you. The sleeve gastrectomy, also known as vertical sleeve gastrectomy or simply a sleeve, involves placing a tube into the stomach to control its size, stapling alongside that tube, and then removing the tube. This reshapes the stomach to be about the size and shape of a banana, removing 3/4 of the stomach and reducing the production of the hunger hormone. It also affects other hormones that can help manage diabetes and obesity. The sleeve gastrectomy has several advantages, including its simplicity and its impact on hunger and metabolism. However, if a patient already experiences heartburn symptoms, undergoing a sleeve gastrectomy can exacerbate reflux or have no effect on the symptoms. In a smaller percentage of patients, the sleeve can cause gastroesophageal reflux disease, or GERD, that was not present before surgery. Before surgery, your surgeon will assess you for heartburn symptoms. Some patients have conditions that make the sleeve a better choice due to its lack of intestinal connections. Patients who already have issues with absorption, abdominal scar tissue, or large abdominal hernias, as well as those with conditions requiring chronic steroid or non-steroidal anti-inflammatory medication use, or who are at a higher cardiovascular risk, may be better suited for a sleeve gastrectomy. The Roux-en-Y gastric bypass is considered the gold standard operation for treating obesity. This procedure has been successfully performed since the 1960s, is highly effective in managing diabetes, and is the preferred operation for addressing reflux. Patients who undergo gastric bypass surgery must quit smoking and refrain from smoking in the future. Additionally, patients using medications for joint and other pain will need to discontinue usage and abstain from them for life due to the increased risk of ulcers at the connection between the gastric pouch and the small intestine. The lower connection in the small intestine also presents a risk of bowel obstruction, which may require emergency surgery in the future. The Roux-en-Y gastric bypass surgery involves 3 main steps. Number 1, Creating a small stomach pouch. The surgeon makes a small pouch from the top part of the stomach, which limits food intake. Number 2, bypassing part of the small intestine. The surgeon connects the small pouch to a lower part of the small intestine, skipping a large portion of it to reduce calorie and nutrient absorption. Step 3, reconnecting the intestine. The bypass section of the intestine is reconnected further down, allowing digestive juices to mix with food. Gastric bypass and sleeve surgeries have similar or superior effects on hunger, metabolism, and diabetes, and the gastric bypass is the most effective surgery for reflux. However, the gastric bypass is a more complex operation involving 2 new bowel connections, which makes it riskier for complications and potential nutritional deficiencies in the future. All surgeries are performed laparoscopically, meaning we use 5 to 6 tiny incisions with the assistance of a long camera and instruments. We also perform revisions and any associated procedures for maintenance, such as gastric band adjustments and conversion surgeries. It's important to remember that all surgeries have risks associated with them, such as bleeding and infection. Additionally, some risks can vary depending on the type of surgery and the individual patient. These risks will be discussed in more detail at your consultation visit. If you are a candidate for bariatric surgery, there are some requirements that need to be met prior to your procedure. Basic requirements include an initial consult, an EGD, dietary education visits, psychiatric clearance, a sleep study, heart evaluation, surgeon consultation, and smoking cessation. Specifics regarding these requirements, such as evaluation and clearance by a heart or lung doctor or sleep apnea testing, depend on each patient and will be determined by the surgeon at the initial consultation visit. The time required to complete all pre-surgery procedures from program enrollment to the surgery itself varies, but typically ranges from 4 to 8 months. It is important to understand that this surgery is not a quick fix, but rather a helpful tool. Our patients often say that it is challenging, but definitely worth it. To achieve success, you will need to continue using the skills and knowledge you gain along the way. One of the most crucial aspects of this journey is making dietary changes. These changes include prioritizing healthy protein, refraining from drinking during meals, and ensuring you consume enough fluids throughout the day. We will provide further details on these and other changes during your dietary visits after the surgery. Moreover, maintaining regular follow-ups with your surgical team after the surgery is essential for sustaining weight loss. It's important to remember that each patient is unique, and we customize both pre-operative and post-operative care to meet your specific needs. If you are interested in learning more about bariatric surgery and would like to schedule a consultation, please complete the new patient intake form on our website, and you will be contacted within 48 hours to arrange an initial consultation. You can also call the Lovelace Medical Group Bariatric team at 505-727-2790 to schedule an appointment.